I'm Delegate Karen Montgomery, one of the 3 delegates from District 14, and I'm going to talk today about 2 bills that I have in front of the body today and this week. I will be coming back and forth several times a month to bring you up to date on some other things that are happening down here. First one I'd like to talk about is a bill I have on Lyme disease, which requires more reporting by the physicians. A lot of people in Montgomery County and elsewhere in this state have Lyme disease, and they are often being treated for it. But the problem we're having is the doctors are not reporting it. When they don't report it, there's no record of it. Now, Lyme disease, left untreated, can be really bad for you. It can cause muscle pains. It can go into your neurological system. It is a spirochete. Spirochetes are related, of course, to the syphilis spirochete, and they do go into your bloodstream. That's what causes the red bullseye. But not everybody does get a bullseye. Many of the people do not. So here are some symptoms to be aware of. Spring will be here. That's when the ticks are out there. And what you may get is extreme fatigue. I'm not talking a little tired. I am talking exhaustion. You may also get muscle aches that kind of float around through your body. Serious headaches, some rashes. They may not be a bullseye, but you may get a rash, and other symptoms that are somewhat transient, but there. The fatigue is important. Now, if you don't get treated with a strong antibiotic right away, you can get into heart disease and maybe some neurological problems that could be long-lasting. So therefore, make sure your doctor is aware, even if you don't remember the tick, that you have these symptoms. If he treats you right away, encourage him to please report it, as he should be doing, but often doctors are too busy to do it. The other issue I'd like to discuss that I feel very, very strongly about is that what we need is health security. Veterans, some of them have VA, so that they can get lifelong, transferable, transportable insurance at veteran centers around the country. We also have Social Security, which runs all across the whole United States. We need some health security. The U.S. has the worst, most expensive system. And by worst, I mean it is the most expensive healthcare system in the world. If that were the case, and that were only the case, it wouldn't be so bad. But our problem is our health outcomes are way down the list. We come in 13th or 14th in a lot of our health outcomes. One of the issues that we have right here in what we regard as rich Maryland is that we have a very high infant and maternal mortality rate. That means that more babies and more mothers die in childbirth and immediately after than many what we call third world countries. We need to fix this. We need health security. We need to make sure people are covered. We've been trying other fix-its. We've tried to help small business cover their employees by giving them state help. It's not working. We have tried to have young people get cheaper but less extensive health care. They're not taking it. It's not working. What we do need is health security. We need a Health Security Act. I have one proposed. I'd like you to support it and your neighbors and your friends and see that everyone who needs it has health insurance. Thank you very much. This is Delegate Karen Montgomery, and I'll be reporting back to you again in 2 weeks. Thank you very much.